I've been in the service for 15 years. Formerly, this place, there was no any chemical shop here. Being at the village, I've been very helpful to them. The knowledge I've gained from Mom is helping them. Yeah.
MAM stands for Mobilize Against Malaria. And it's one of the projects that has been set up to actually mobilize communities, mobilize the private sector and the civil society to be able to respond to the scourge of malaria within the country. The licensed chemical seller basically is someone who has been given a license to sell over-the-counter drugs. And in that community, he might be the only point of call. In Ghana, they are present everywhere.
The MAM program is testing this hypothesis, if you like, that yes, licensed chemical sellers, if they are properly trained, if they are properly supervised, if they could get access to medicines, could make a difference to the quality of care.
We went on and we provided skills and we provide the necessary tools that the licensed chemical seller needs to be able to treat malaria appropriately, to distinguish between complicated and uncomplicated malaria, collect the necessary data that is required to be able to dispense ACTs and conduct the necessary referrals.
So the thing was to standardize the knowledge and treatment procedures in line with the approved treatment guidelines of the National Malaria Program, get them all to understand what they should do and why they should do it.
Now, a chemical seller is bold enough to explain how malaria is and the way he can also treat it.
Their knowledge base on malaria has gone up, how to give the new treatments, that's the artemisinin combination therapies, to a large extent has improved.
So that was the supply side. The community is the demand side.
MAM has also been able to mobilize communities to be able to be aware of malaria and also to respond to the changing pattern in the treatment of malaria.
Doctor Alonso, and I was a drone, be an answer. Now the more drone. It's all the drone, Banawa, no more drone, said they watched on one man and Sunday and Dura, Yalian and you. It is a good boabo.
GSMF was responsible for the demand side of MAM. Community mobilization, house-to-house mobilization, community information centers, working through CBOs, working with the faith-based groups to ensure that the information sticks. We chose the faith-based people because Ghana, as a country, have a lot of very religious people. We've trained 210 fathers, pastors, priests, imams, ministers. These are people who have to repeat the same story over and over and over again. Let's give them the right information.
With the congregation, they believe the pastors. And if they know that if the pastors have gone through that training and it is also sound, and they speak it out, it will really have effect on them. So if we don't have healthy people, then we cannot have healthy churches.
Awareness is the first stage in behavior change. That is what MAM was addressing.
The lessons learned from the MAM project can be easily incorporated into other malaria control program activities in the country. The private informal sector can be organized to be part of national control efforts.
One thing stands clear, we can use licensed chemical sellers to manage malaria effectively.
You take 4 in the morning. Malaria, yeah, it is improving here, getting better.
What I say, I will thank MAM and the Pfizer company and others who joined together to do this training program in Ghana.
If this is replicated, what we're going to have is a country where you walked into a home, a baby has a fever, and the mother knows what should be done and can have access to the right intervention. I think that is what it promises. That's what it promises.